Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. So Missy wrote in and said, "Hi, Dr. Doreen. My son has recently been telling me that he's unable to focus at all, especially in school. Are there ABA techniques to help with this? He's 11. This happened more since he has had many changes at school. His BI was changed, and also his therapist right after coming back from Christmas. He keeps hitting his head and saying he is stupid. He is frustrated with himself." I wanted to make sure we got to that one.
Okay, so this is happening in school. You need to immediately get the school involved, first of all, because any kind of change that occurs in school, that it needs to kind of be written into his IEP. They need to realize that they have some level of responsibility towards helping you at this point, Missy. So I would really call for an IEP. I would call for an IEP and I would say, listen, I know this new BI might be okay or whatever, but you guys have changed. And I assume you're talking about a behavior intervention plan has changed and we got to do something because right now he is having a really hard time. Maybe it's his therapist. Maybe you need to provide further training for this individual, whatever it is. You guys changed something over the holidays and things are not doing so well. Now, I do want to point out that possibly, and I don't know where you are or when school started, a lot of times when our kids have a break and they go back, obviously it's a hard transition going back. So make sure the transition phase has changed. And if it has changed, and I love that he himself has come to you and said, I'm having a hard time focusing. Find out about other things too. Like for instance, has his location in the classroom changed? A lot of times, like if our kids are next to, you'd be surprised. I mean, I've had children losing focus because now they're sitting closer to the vent and the sound of the vent is so high for them that they are distracted. Or now they're sitting next to a window and they can look out the window, whereas before they couldn't. Or now there's another student sitting next to them who smells a particular way. I mean, find out what has changed because that is super important. We don't usually go from things like focus don't change like that. They don't change overnight or over the period of a week. They just don't. So some other external factor is causing this, whether it is a dietary change, a location change, someone in the class is making him feel not safe. I don't know, and it could very well be a dietary change like sugar, a food additive, whatever it is. Look into all of that and make sure while you're figuring this out that you explain to him that it isn't him at all and that things are going to be fine and that maybe he can help you figure out what has changed so that you can try to help revert back to how he was doing.
There you go. All great advice, but please let us know how it goes, Missy. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. To subscribe, click here. And if you'd like to check out some more of our videos, click here.